The federal government, alongside the Gates Foundation and the Dangote Foundation, has reiterated its commitment to eradicating polio and other infectious diseases in Kano State. The pledge was made at the Government House in Kano, led by Coordinating Minister of Health, Professor Muhammad Pati, with other partners in attendance.
The purpose of our visit, actually the purposes are more than one. There are at least two, and they are interrelated. One is about an infectious disease, which is spreading and which we want to control. And Kano is a very central element in Nigeria's effort to deal with any kind of infectious disease. 2023, when we had diphtheria, Kano was the epicenter. And a task force was formed, and with aggressive effort, that diphtheria was tamed, even though not completely extinguished. Many years ago, when Nigeria had challenges with eradicating wild polio virus, Kano was at the center of it. And in 2009, when His Excellency the Governor immunized his own daughter here in Nasarawa, I think it turned out to be a major game-changing event for the fight against wild polio virus in Nigeria. Once Kano was controlled, the rest of the country was controlled. So Kano is a very important epicenter for any infectious disease control effort in Nigeria. So we're very grateful that His Excellency signed into law the Kano State Center for Disease Control Law. So congratulations for that. And the institution, I hope, will be effective, efficient in helping Kanos have good surveillance systems and good disease control measures. But having eliminated wild polio virus for several years, we still have to finish the job of eradication by dealing with the circulating variant polio virus. And I believe the partners that are here with us, Gates Foundation, WHO, UNICEF, are all worried that we still have cases of circulating variant polio, which Kano accounts for, not necessarily the worst case that it could be, but significant number of cases that have been detected. Kano has 637 deaths per 100,000 live births among women. It's higher rate of maternal mortality than the national average. Child mortality is also higher in Kano State than the national average. But Kano is a state that is capable of reducing those numbers. And with your leadership and with the support of His Excellency and the prioritization, we believe it can be reduced, so that if Kano can reduce it, Nigeria's numbers overall will go down. So we'll work with your team, Your Excellency, to ensure that every pregnant woman and child receive the support that they need throughout pregnancy to childbirth and to survive beyond that.
Governor Abba Yusuf, represented by Secretary to the state government, expressed gratitude for the minister's visit and the support from donor partners.
This visit marks a crucial moment in the long-standing partnership between Kano State and the Gates Foundation. Over the past decade, the partnership had transformed our health sector, saving countless of lives and improving the well-being of our people. The challenges we face are significant, but they are not insurmountable. With the continued support of the Gates Foundation, the federal government, and our dedicated healthcare workers, we are confident that we can overcome these obstacles and achieve our health goals. Polio eradication. We will intensify our efforts to interrupt CBPP2 transmission by strengthening surveillance, vaccination campaigns, and community engagement. We will also allocate additional resources to ensure the success of these efforts. Routine immunization. We will, without doubt, prioritize the reduction of zero-dose children by improving immunization service delivery, addressing vaccine hesitancy, and enhancing data collection and monitoring. Primary health care strengthening. We will continue to invest in the revitalization of the primary health care centers, with focus on workforce training, supply chain management, and infrastructure development. We will also explore innovative ways to integrate services and improve healthcare access for all.
In separate remarks, Christopher Elias, president of the Gates Foundation, and Dr. Ahmed Iya, a representative of the Dangote Foundation, reaffirmed their commitment to eradicating polio. They also urged the state government to intensify efforts to eliminate polio and promote routine immunization.
The foundation has been a long history of partnership here in Nigeria, and in particular here in Kano State, on a range of different health issues. And we're very excited to be part of the effort that the coordinating minister and his team have launched for revitalizing the primary healthcare system through the sector-wide approach and Project Hope. And I think, as he described, there's a set of very positive incentives for various states, including Kano, to participate in crashing maternal and child mortality and to building a stronger primary healthcare system that can meet the needs of all of the Nigerian population.
My appeal to all of us from today, the media, you are the number one. Telling the parents, not the story that you wanted to tell about what the minister said as headlines. Tell the story that will compel the mothers not to fake the children and to bring out the children so that they can be immunized. And not only telling them once, tell them until when it becomes part of their life and habit.